We're broadcasting from the Middle Tennessee Electric Studios. Visit
mte.com.
Middle Tennessee Electric, serving to make life better since 1936.
This is the WGNS Action Line. Talking with Rutherford County newsmakers
since 1947.
The WGNS Action Line. Now your host, Scott Walker.
This morning we're going to be talking about mental health. With us in studio, we have got Ella Britt, Vice President of Community Outreach for Volunteer Behavioral Health. And then also we have State Representative Mike Sparks, who's joining us by way of phone this morning. Mike, I know you guys are in session right now, so we'll head to you real quick here. What's happening right now?
Ironically, we're fixing to be on a mental health bill, and I think I've shared this letter that I received from the late Dr. Linda Gilbert after we put together a mental health forum at Parkway Baptist Church and had mental health, substance abuse, and I think volunteer behavior and Tennessee Mental Health Cooperative. But I wanted to share this letter real quick with your listeners. And Ella, here's a letter. After I'd done this event, I asked her what the silver bullet was to help folks, and here's what she went on to say. Remember, after this letter, she died a week later. This is one reason why this letter is so important. She goes on to say, I apologize for being so delayed in responding. Thank Representative Sparks for reaching out to me. More funding for counselors would certainly help with the social and emotional issues we're seeing in young children. Many school districts are unfortunately not to be able to fund these positions. He goes on to say, I also think it would be important and helpful for him and other lawmakers to reach out to school superintendents about the issues we're seeing in very young children. Here's what's very alarming. Remember, this has been about 5 years ago. She said the behaviors of our 6 to 9-year-olds like nothing we've ever seen before. They're disruptive and aggressive while we're bringing all our resources into play. There's currently no place for these children to go to be assessed. She goes on to say, I feel good about the education departments which are trying to accomplish. Emphasis on the whole child. Maybe Ella can talk about that. She goes on to say, I'm hopeful that the Department of Mental Health and Substance Abuse will work alongside them to address children for whom there seems to be no answers. Remember, this was a 50-year educator. She knew more about education and children than any lawmaker up here, and I would argue the chairman of education. But we're fixing to get on a mental health bill here in a little bit, so I'm going to get back on the floor. But if Ella could maybe talk about the man that I honored last week, We Live for Riv, nonprofit. Sadly, he found his daughter hung in her own closet in September. She was 14 years old. And I think there was a correlation with some things online. In fact, I sent him the lawsuit against Meta to see if he wanted to try to get involved with that. He thinks there was something there that led to her suicide.
The lawsuit that Representative Sparks referred to, Meta is facing significant legal setbacks regarding allegations that its platforms through social media are designed to be addictive and harmful to the mental health of children and teenagers. Just this past month, a Los Angeles jury in California found Meta and YouTube, owned by Google, liable for contributing to the mental health struggles of a 20-year-old woman who allegedly started using the platforms as a child. This was the first test case of roughly 2,000 pending lawsuits. And the jury found the companies were negligent, and they failed to warn of dangers and acted with malice of oppression of fraud, awarding $3 million in compensatory damages and $3 million in punitive damages. And then a New Mexico verdict where a jury ordered Meta to pay $375 million in damages for failing to protect young users from child predators, finding Meta lied about the safety of its platforms. But these key lawsuits this year suggesting that some of these platforms tied to Meta, used for gaming and other interactive tools online, were harmful to youth.
I'm going to get back on the House floor and turn it over to Ella, if that's okay, Scott.
Again, State Representative Mike Sparks, and thanks for joining us.
Thank you, Scott.
So, Ella, you hear stories like that where young children, teenagers, and even young adults committing suicide these days. What can you do about that? I mean, what are services that can be provided to help prevent things like that?
Absolutely, Scott. And I want to thank you for having me today. I always enjoy listening to the show with you and Brian both, and I also really appreciate being able to be here from time to time. One of the things I'll say is that We really have a lot of problems with folks finding out the services and getting help because of the stigma around mental illness or mental health issues. And so one of the things we want to do is help folks to fight against stigma so that folks will be able to locate the services they need. You know, Scott, there's several things about that, and I want to address all of the questions that you ask. But I'll start out with this. If people could start talking openly about mental health and educate themselves and others about mental illness. There's so many misperceptions and negative comments about folks with mental illness. We need to encourage equality between physical and mental illness. Draw comparisons to how you would treat someone with cancer or diabetes, because there's no difference. There's a way to manage physical health issues. There's a way to manage mental health issues. So we want to normalize mental health treatment, just like other healthcare treatment. And I think a couple of pointers I will share that are really huge would be showing compassion for those with mental illness. People oftentimes are afraid of something they don't understand. So if we can educate ourselves about mental illness, then we can show compassion and choose empowerment over shame. And I think that's really important today for folks to be willing to find the help that they need.
So in order to start on this better path where people have a better grasp of mental health issues and understanding it, it almost seems like there needs to be more education on it within the local schools, starting at an earlier age even.
And I will say that that is something we have been blessed in the state of Tennessee. The state has set up a program that's school-based behavioral health liaisons, and we have them in 89 schools right now. Those are licensed counselors that work with the school and with the children. We have several school-based programs at Volunteer Behavioral Health, and we work closely with the community, with the school system, with law enforcement. We are actually a part of the Rutherford County Schools crisis response team. So when they have a crisis, the team gets a call. They reach out to me from Volunteer. We're able to bring in counselors as needed to the different schools. And we'd like to do that in other counties. We actually serve over 50 counties in Middle and East Tennessee right now.
Stories like the one Representative Sparks told where this young person took their own life. Do you hear those stories often?
Yes, I'm also a licensed therapist, and most of my career was providing therapy. I now am blessed to be in outreach and marketing and try to help make sure folks that need services are getting what they need in all of those communities. But we do hear that quite often. It's very unfortunate. Sometimes it's just not knowing what to do. Sometimes it's being afraid to do something, or maybe feeling like they won't be taken seriously. And then oftentimes it's the shame. You know, we've got to empower people to get help and not be ashamed of the things they feel.
Now, depending on what level of mental health issues somebody may have, it can be really hard on family members, on friends, in convincing that person that they may need some outside help here.
You're exactly right. One of the things that we have set up at Volunteer Behavioral Health is we have a first-time appointment line, and when someone calls that line, there is a trained person that will do the assessment right then, help determine what their needs are, what services that they need, and then they will go ahead and set them up with those services. So if they need therapy, they'll go ahead and get a therapy appointment from that call. They will do it during that call. They will also get an appointment for med management if they need an assessment, and they will immediately be assigned a care manager to be able to help them maneuver through all of that. If they do not have insurance, then we have a program from the state that's called the Behavioral Health Safety Net Program. And through that, we can go ahead and serve them and then work with them to get them on TennCare while they're already getting services. I'd love to share that number with you.
Yeah, what is that?
So I want the audience to get the number for our first-time appointment line, and it's 877-567-6051.
And so that's the number that, you know, somebody out there listening who may need help, or they may need help for a family member, they could call that number, then start at that step right there.
Absolutely. And if it goes beyond them realizing they need help to being actually a crisis situation where their mental health is in jeopardy and they need to talk to someone We have a crisis line that's 24/7 that they can call. It's 800-704-2651. They can call and talk to someone anytime, 7 days a week. They also, if they're afraid to talk with someone, they can dial or they can text 988 on their cell phone. They can call 988 or they can text 988, and they will immediately get response and referral and help.
I didn't realize that. Mental health is an interesting subject because there are still so many things that are unknown. I mean, there's so many science breakthroughs that have yet to be made. There's just a lot of discoveries out there that haven't been made yet. I think in the near future, we're going to see a lot of changes with mental health help.
I think you're right. One thing that's become very, very recognized is May is Mental Health Awareness Month. During the month of May, everyone on my team at volunteer as well as just staff across the volunteer agency, we go out and do presentations. We talk to different people about what's going on with mental health and help them to become aware. We go to employers and talk to them about what employees need from their employers to be able to get the help when they need it. So there is a great opportunity every May for us to just reach out and talk to folks and help make them more aware.
What are some of the different mental health problems or diagnoses that you see and hear about that are more troublesome for family members, for friends in trying to get that person help? But what are some of those different titles of those diagnoses that people may have the hardest times with?
Actually, a couple of what we would consider the simplest or most common, and we would think we don't need to get help for, but that's depression and anxiety. People tend to think they can just overcome that on their own, but that's not always the case. So, if someone has depression or anxiety, if they will go ahead and get help early on, they can learn how to manage that so that it doesn't become a bigger problem for them. And then there's always the major diagnosis that we see, schizophrenia, bipolar, things that people absolutely have to get treatment medication for.
And with things like schizophrenia, what's so, fascinating from the outside looking in is that somebody can go half their life without any problems, everything's normal, then one traumatic event occurs, and next thing you know, they're not acting like their self, and they're later diagnosed with having schizophrenia.
That is correct. Many times, mental illness is triggered. It could be by substance use. It could be by a traumatic event. Our veterans, our military, they deal with PTSD. Our law officers, ambulance, everyone, all the first responders, they deal with PTSD from what they've gone through. And that is a mental health diagnosis that they do need help with. It's not something they can typically manage on their own.
That's one of the bigger problems is people think they can manage these things on their own without understanding that, I don't know how to put it in simplest terms, but the chemicals in your brain are not working correctly and you need a medication to change that chemical makeup. You can't just do it on your own.
Absolutely. Again, that goes back to equality between physical and mental illness. No one would think twice about a diabetic taking insulin every day. But when it comes to mental illness, people tend to think a lot of times that, they go to treatment for 30 days or they get help for a little while and then they're well and it's all gone. And it could be a lifelong situation for them. Yeah,
it's like once they start taking the proper medication to feel better, they start feeling better. And then they say, oh, I don't need this anymore.
That's true. A lot of times they will stop taking their medication because they do feel better, but also because of the side effects. A lot of psychotropic medication has side effects that are very uncomfortable. So when they feel like they're better, they want to get rid of the side effects, so they stop the medication many times.
Do those side effects with the medication, do they last long term or eventually do those go away?
It depends on the person, their body chemistry, the medication, if they're taking it as prescribed. There's so many things involved there, but I'm sure there are times when it is prolonged, and there are others that are able to manage it, get used to it, or it changes as their body adjusts to it.
And then when some of these people come off the medication without letting anybody know, that they can actually lead to things like suicide. I mean, it can change the way you think completely by just cold turkey getting off these medications.
You're exactly right. And there are some things that people can do to help with their mental health, whether they're diagnosed or not. There's some things that, as a human being, we can do to help our mental health. I'll share a few of those with you, if that's all right.
Yeah.
Connecting with other people, having relationships, that's so very important for our mental health. I think we were made to interact with others and not to be alone. Being physically active, not just for your physical health, but when you're physically active, that releases endorphins that decreases depression. So when we work with folks with depression, we want to make sure that they get up and get to moving because of how that really does help the brain to help them decrease that depression. Also, learn new skills. When we get out of school, sometimes we think we're finished learning. Our minds, our brains need to continue to learn, and then that helps us to have different focus. It helps us to be distracted from the things that might cause us to be anxious. So we want that. Giving is very important, not necessarily financially, but give of ourselves to others. Give our time, be kind, give a smile. You go through the checkout line and you're frustrated and tired, and you get up and the checkout person is not having a good day, and you don't know what they've been through.
Yeah.
So the best thing you can do is give them a smile and say thank you, or hope you have a better day, or hope you have a good day. And then something that's very important is mindfulness. Pay attention to the present moment. Don't let your mind wander. When you're with someone, be with them, talk with them, listen to them. When you're in an activity, be a part of it. Don't be distracted by thoughts that might cause, your anxiety or depression to be sparked.
During the whole COVID period, I think that's the first time that people really started to understand how bad depression and anxiety really could be on people. And that's when a lot of people learn for the first time that, isolating yourself is the worst thing you can do.
It is. And we were in a situation where we didn't have a lot of choices around that. For a certain amount of time, everyone was pretty much isolated to their own family or to themselves. And so it did prompt a lot of mental health issues. Absolutely.
And there were a lot more, anxiety diagnosis, and a lot more people who all of a sudden had depression and didn't know what to do with it for the first time.
Yes. I'll tell you something we did find out through COVID is that we were able to develop and utilize telehealth so that we were able to help people even though they couldn't leave their homes. And since COVID is past and we are able to be out again, there are certain diagnoses that we find that works better than them coming in person to their therapy sessions. So we now have two ways to help folks. We can help them in the office in person, but we can also help them through telehealth, and they don't ever have to leave their home.
I would guess that that's totally changed medicine in a lot of ways, because if you are battling anxiety or depression, you may not really want to leave your house at all, like you're talking. That it makes sense.
Right. And as someone works with them through therapy and their care manager and medication, if they're on it, we can get them to a place where they are comfortable being able to leave the home and come in. And we always have them come and see us. We have so long before we'll say, okay, it's time for a face-to-face. But when we're doing telehealth, we're seeing them, we're seeing what's going on with their expressions and their nonverbals so that we can correctly assess if they're doing okay.
Again, with us this morning, Ella Britt, Vice President of Community Outreach for Volunteer Behavioral Health. And once more, if anybody would like to learn more, where's that first place to start?
Well, it would be with that first-time appointment number as far as getting services. And that was the 877-567-6051.
And I'm sure we can Google online Volunteer Behavioral Health and learn more about everything there as well.
Absolutely. All of our programs are listed, all of our locations. We have 21 offices across those 50 counties, but we also have added services in 21 additional in health departments. So we have partnered with health departments to provide services in areas where we don't have an office.
Now, are there offices here in Rutherford County?
Yes, we have one in Smyrna and in Murfreesboro.
Okay. And again, Ella Britt with us this morning, Vice President of Community Outreach for Volunteer Behavioral Health. And as we close, is there anything we left off that we should mention?
I think I would just say to anyone that's listening, if you struggle, if you have any thoughts that you need some help with your mental health, please reach out. When you make that call, you are going to have someone answer the phone that is there, trained and wanting to help you. Don't wait. Go ahead and get that help.
And sometimes it's just that one single conversation with somebody who can lead that person down the right path who's struggling with some type of mental health issue.
Yes.
Thank you for joining us this morning.
I've enjoyed it very much. Thank you, Scott.
Hi, this is Wade Hayes of Toots Restaurants, and I'm sitting here with my grandson Jack, and I never will forget, the first meal he ever had that wasn't a kid's menu item was the
baby back ribs.
That's right, and I couldn't believe it, but I was so proud that he ate ribs and loved them.
Hi, this is Nick Hayes with Toots Restaurants. Don't forget about our Monday through Friday lunch specials. They're only $6.99. Slide by and you can even pick them up to go.